So this is Neelam Sahu, and I'm going to teach you pulmonary edema. So what is the pulmonary edema? Pulmonary edema is a buildup of fluid in your lung. A main cause of pulmonary edema is congestive heart failure. It can occur due to non-heart related condition. Two symptoms include shortness of breath and difficulty of breathing. Sudden and acute both are there. Pulmonary edema requires immediate treatment. Now comes to what is the difference between pulmonary edema and pleural effusion. When abnormal amount of blood build up outside of your lungs in the pleura, which is a lining around your lungs. The pleura sits between your lungs and inside of your chest wall. Pleural effusion is the commonly cause of pneumonia, congestive heart failure or cancer. The fluid sits outside of your lungs and can compress your lungs, which are spongy. Now comes to sign and symptom. There are two types of sign and symptom, cardiogenic and non-cardiogenic. So cardiogenic pulmonary edema means fluid backup in your lungs from a heart problem. The most common causes of cardiogenic pulmonary edema is congestive heart failure. When the left side of your heart stop pumping blood correctly, the blood back up into the blood vessels in your lungs. As the pressure in your blood vessels increase, fluid is pushed into the air sacs in your lungs. The symptom will appear heart attack, weakness of muscles, cardiomyopathy, valvular heart disease, hypertension, arrhythmias, inflammation of the heart, fluid and pericardial infusion. Non-cardiogenic pulmonary edema occurs when other disease cause fluid to accumulate in your lungs, isn't caused by increased blood flow in your lungs due a backup from heart problem. Instead, the blood vessels in your lungs become inflamed or injured. The blood vessels then become leaky. The fluid goes into your air sacs. The symptoms will appear like pneumonia, sepsis, trauma and pancreatitis, liver disease, drug, bleeding, swelling of your brain and pulmonary edema. Now comes to pulmonary edema, long-term pulmonary edema. The symptoms are the same as the previous, but the symptoms may be milder. Other symptoms or long pulmonary edema included feeling of breathlessness and awaken you, shortness of breath when lying flat. Diagnosis and test. Increase or decrease like tachycardia and bradycardia, increase respiratory rate, abnormal heart sound, whistling and wheezing sound, swelling of your body, grey bluish skin. The diagnosis like complete blood count, blood chemistry, pulse oximetry, chest x-ray, echocardiogram and electrocardiogram and cardiac catheterization. Now comes to the last but not least, management and treatment. Oxygen delivered through plunged in your nose, machines that blow air into your lungs through a mask on your face, ventilator and respirator that blow in air through a tube inserted into your windpipe, medication that causes you to urinate more and get rid of fluid or which strengthens your heart. Other medications when congestive heart failure isn't the cause of your pulmonary edema, such as antibiotic and steroid. These are the point of pulmonary edema, and now finish my topic. Thank you.